Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, second type of retinal detachment is actually tractional type of retinal detachment. So, in the tractional type of retinal detachment. So, first the causes of tractional type of retinal detachment are due to vascular pathologies of retina, especially like diabetes mellitus, chronic renal, central renal vein occlusion, Ailes disease are causes of tractional retinal detachment. So, vascular pathologies of retina like diabetes mellitus, central retinal vein occlusion, or Ailes disease. Here, there is traction. The retina is pulled up due to these conditions. So, because of this pulled up of retina, it appears a concave arrangement is seen in the tractional retinal detachment. And in tractional retinal detachment, the patient will present with there will be decreased visual acuity is seen, especially if the macula is involved, or else the visual field defects are seen with decreased mobility is seen in the tractional retinal detachment. Treatment is you should remove the traction, so it is better to do the vitreous surgery. Vitreoretinal surgery is done, or pars plana vitrectomy can be done in the patient of tractional retinal detachment.
thank you and thank you for watching.